Okay, November is Lung Cancer Awareness Month, and you may not know, but nearly a quarter of the people who die from cancer were diagnosed with lung cancer. So today we have Jacqueline Odom from the Bon Secours St. Francis Cancer Center here to talk to us more about this disease. Jacqueline, thank you so much for joining us.
Yes, absolutely.
Yes, we hear a lot about lung cancer, but a lot of people don't realize how many people die from lung cancer. Why is it so different from some of the other cancers when it comes to deaths associated with it?
Right. I think the important thing to note with that is the importance of screening. People generally are aware of screening for breast cancer, colon cancer with mammograms, colonoscopies, Cologuard. However, there's not as much awareness surrounding screening for lung cancer, and it's a relatively newer screening modality, but the low dose CT is the screening method for lung cancer.
What does the screening look like, and then who should be screened?
So the screening is recommended to be completed annually for high-risk individuals. And those individuals are in the range of 50 to 80 years of age and have had a smoking history, a 20-pack year smoking history. And I think the important thing for people to remember is that if you are 50 or older and you have a history of smoking, you should mention that to your primary care provider so that they can have a discussion whether or not you would be eligible for that test and if that would be something that could benefit you.
And is that something outside of any type of side effects, are there side effects or some symptoms to
So yes,
lung
there
cancer?
are symptoms. Symptoms of lung cancer can be persistent cough, coughing blood, weakness, pain, fatigue. However, many times when patients present with symptoms, the disease has already spread. So screening is something that's done for patients who are, again, high risk and typically, hopefully, asymptomatic, which allows the opportunity to diagnose this disease in an earlier stage where then patients have a higher chance of surviving the disease.
And lung cancer is tricky too because by now a lot of us know smoking cigarettes not good for you. We know what it can do. But there are people that are, our age and younger that are getting lung cancer that have never smoked a day in their life. And you're like, what in the world?
Right, that's true. But I will say that the highest risk individuals and the majority of patients who are diagnosed with lung cancer, they do have that smoking history.
If you stop smoking, does that help?
Yes, and they actually, certain societies have just updated the screening criteria where they used to say people who had quit smoking in the past 15 years were not eligible. However, that has been lifted where any smoking history now would make you eligible, potentially eligible for this screening.
And speaking of those screenings, you have a screening event coming up. Tell us about that.
We do. Some barriers to screening have just been access, and people work. They don't have the ability to take off work to have a test like the low-dose CT scan completed. And so during Lung Cancer Awareness Month, they do have a screening day, which this year is November the 11th. And so we do have our center open at our downtown campus to complete those scans for individuals who maybe aren't able to have that done due to their schedule.
Access is so important, especially when it comes to healthcare. 8 a.m. until noon at the St. Francis downtown campus.
Do we make an appointment for this?
Yes, I'm glad you brought that up because this is something that would require an order from a provider. So if you think you may be eligible, you can contact your primary care provider and they can, again, order that test, have that conversation as to whether or not you would be eligible for that and you could benefit from it.
Thank you for doing this, and gosh, hopefully this is going to save some lives.
Yes, hopefully.
A lot of stress for people.
Thank you so much. Great information.